Taiga Healthcare, a leader in providing senior living, home health care, and hospice-related services throughout the DFW Metroplex. Our second sponsor is Dallas Renal Group, a physician group that me and Dr. Micadia belong to. Dallas Renal Group provides comprehensive kidney care, including transplant and home dialysis services. Information can be found on our website, dallasrenalgroup.com, or on the Dallas Renal Group Facebook page. And this is Dr. Shri. I'm co-hosting today's show with Dr. Parin Micadia, and we are live in the studio with Dr. Sophia Rahman and Ms. Amanda Galloway, and we are talking about hypertension and cholesterol. The number to the studio is 972-235-5555. You can call in with your questions to the experts. Dr. Rahman, during the break, we had a couple of questions on high cholesterol. There was a listener who was asking me, she has a 0 calcium score, but still she has hypertension and high cholesterol. Does it need to be worried, or how does the correlation go about it?
Well, first of all, a calcium score of 0 is actually pretty good. It basically says, her risk of having a blockage in her artery is a little bit low. However, because of the diagnosis of high blood pressure and high cholesterol, we still encourage you to continue to take care of it. That means you're doing a wonderful job, so please take your medications if you are on medication, or continue to exercise, watch your diet. And that is my advice to you.
One more question, Dr. Rahman. Diet, like in the Asian population, they consume a lot of carbohydrates. Do you think that has any impact on cholesterol?
So carbohydrates, certain carbohydrates are good, like grains and legumes, those kind of things, like beans. Those are fine. Certain other carbohydrates you want to avoid because, again, that can lead to diabetes, and there are some correlations with, the cholesterol and the diabetes. So you want to also kind of be careful with that.
All right, listeners, now we're going to switch topics to hypertension. So, Dr. Rahman, we heard a lot of numbers associated with high blood pressure. Could you go through what those numbers mean? For instance, what could be the numbers associated with normal blood pressure?
Yes, definitely. So I guess, some of you guys that have, gone to the doctor's office, you've noticed, blood pressure with a top number or a bottom number, and you've probably always wondered what they mean. The top number actually represents the pressure in the arteries when your heart is actually contracting, and those are usually a 3-digit number. Hopefully, most of the time it's a 3-digit number. And the bottom number is actually usually a 2-digit number. And it represents the pressure in the artery when your heart is actually relaxing. Normal blood pressure is actually 120/80, but again, there is some leeway depending on your risk factors, and again, you would have to talk to your doctors about that.
Thanks, Dr. Rahman. Let's take another call before we proceed. Dr. Akla, what's your question?
Amanda, you want to?
There's a lot of factors that can play a part. Diabetes, yes, you get concerned about. High cholesterol, you can get concerned about, and blood pressure. Sometimes people have all three, and that can be metabolic syndrome, and you have to manage all three. And usually, if you can manage one with lifestyle changes in diet, you can tend to manage the other two. They're going to be better controlled. So they can be tied together. So that's why you just have to make sure you're making the lifestyle changes, the modifiable risk factors. The ones you can't change are, once again, genetics.
All right. Thanks, Ms. Galloway. One more thing, how would someone know that he or she has high blood pressure?
Sometimes some people don't know they have it, and they come in for their regular doctor's visits and their blood pressure is elevated and they didn't even know they had high blood pressure. Some people can sense it and they have headaches, some people feel dizzy, some people have had nosebleeds and have elevated blood pressure, but we get concerned about the people that don't know their blood pressure's up. They're the risks of having a stroke. People that sense it, they come in.
Well, I just wanted to add, to Amanda's answers, that's kind of where, when you get to that age where, you think you need to go see a doctor, it's important to see a doctor regularly. But if you don't want to see a doctor, or, if you have an insurance problem, that's fine. There are multiple pharmacies that have blood pressure machines, and you can go check it for free. And that's what I would recommend if you are worried and you have a family history of it.
Oh, thanks, Dr. Emma. Let's take some calls right now. Dr. Klein, what's your question? All right, that's an excellent question.
That's actually a very good question. So, I guess if you're tuning in, I actually kind of mentioned this earlier, you have to consider your arteries as like water pipes in your body. So with blood pressure, high blood pressure is basically saying that you're decreasing the blood flow to your kidneys, and I'm hoping our two hosts would agree with me. Maybe they can add to it, huh?
Yes, that's right. It's very important to control the blood pressure, and kidneys take a big toll on it. Thanks, Dr. Emma. Let's take another call. Yeah. Dr. Klein, what's your question?
So the caller's asking if the blood pressure may vary from time to time because he's having some variability in his readings. So maybe this would be a good time to recommend how would you check a blood pressure at home?
Blood pressure can vary from day to day. Blood pressure is very labile, so it changes quite frequently. You could be under a lot of stress that day, or you might not have got sleep that night, and that can affect your blood pressure. Driving down 635 in peak hour traffic can make your blood pressure go up. So there's lots of different factors, but a good way to really check your blood pressure is to sit comfortably in a room for about 10-15 minutes with your feet flat on the floor, not crossed, and you want to wear a blood pressure cuff and make sure your arm is resting comfortably on a table. And if it's elevated, wait another 10 minutes. You can check it or check it on the other arm. They should be pretty consistent. The other thing is if you're concerned about a high blood pressure, there's always fire stations. You can always get it checked there for free, and then make an appointment to follow up with your PCP.
Thanks, Ms. Galloway. Let's take another call. Dr. Klein, what's your question? Yeah? Go ahead.
Thank you for your question.
So this is Dr. Rahman here, and again, as Amanda said, there can be variabilities. I've had cases where, patients have wonderful blood pressures at home and they have terrible blood pressures in the office, and so it really varies. And I would check it again, make sure you check it for the next couple of weeks, and as Amanda stated earlier, hi, this is Dr. Rahman here. That's actually a very good question. There's a couple of things, a couple of factors. Main thing is the salt. Salt can actually cause your blood pressure to be elevated. So high salt diet causes elevated blood pressure. A lot of the food that we have in the U.S. are processed, deli meats or bacon or the canned soups, the condiments, your snack food. So again, I'm not sure what a diet is here. Maybe it's a little bit different than what it is in India, but I've noticed that here it's a lot more processed. So that one, it contains a lot of salt, and you'll probably see it as sodium on your nutrition label. So I would try to watch those.
Thanks, Dr. Rahman. Let's take another call. Dr. Aklai, what's your question?
So this is Dr. Rahman here again. I guess you just tuned in. I kind of mentioned it earlier. So you have the top number and the bottom number. The top number really means it's what the pressure of your artery is when your heart is contracting. The bottom number means what your pressure is when your heart is relaxing. So that's what those numbers mean.
All right. Thanks, Dr. Rahman. Let's take another call. Dr. Aklai, what's your question? Hello, what's your question? Ms. Amanda?
Okay, this is Amanda. On the DASH diet, a lot of the time we're talking about, main thing is watching your sodium, trying to eat well balanced. You want to make sure that any foods, like with what Dr. Rahman said earlier, look at your labels when you're buying foods. Things that you might think are low sodium, there actually is salt in there, and some of it's surprising as well. So you want to follow a low sodium diet. Exercise is part of your daily routine. So those are ways to help with diet to control some of the cholesterol with the DASH.
I do want to add one more thing. Stress is an important factor. Please control your stress levels if you can. That will cause blood pressure to go up. And I know the question is about the diet, but stress is also part of it. Stress eating, maybe.
Excellent. Thank you so much, our guest, Dr. Rahman and Ms. Amanda Galloway, for coming on our show. We're approaching the end of the show. Next week, we'll have another exciting topic, and we'll see you next week.
That was a paid program.